Welcome to Digital Health Talks, where innovators and changemakers share how they're transforming healthcare through technology. Join Megan Antonelli, who will be shining a light on the good things happening in digital health.
Hi, everyone. Welcome to Digital Health Talks, changemakers focused on fixing healthcare. I'm your host, Megan Antonelli, and today I am so excited to have Gene Bowen, founder and president, and Jack Bookbinder, co-founder and vice president of Road Recovery. Road Recovery is our charity partner at Health Impact. We had the pleasure of hosting them and meeting them at our January event, and they are a nonprofit that has been instrumental in creating life-changing opportunities for at-risk youth through their mentorship and music over the last 2 decades. Their work has never been more vital. And I think what we've been exploring and talking about within healthcare is, how to make healthcare more human, and, that art and medicine and the intersections of music and medicine and music and healthcare. And so we are excited to welcome them to the show. Hi, Jack. Hi, Gene. How are you?
Hi, Megan.
Hi, Megan.
Good to see you both. Jack, why don't you introduce yourself, and then we'll hand it over to Gene to tell us a little bit about the founding story behind Road Recovery.
Sure. Jack Bookbinder, co-founder with Gene Bowen, and we got together as early as 1990 after both attending NYU, but not knowing each other there. And we were both in the music business. Gene was a tour manager. I was a personal manager. But then we decided to launch Road Recovery in 1998, nonprofit 501c3. And it's been chugging for 27 years and extremely gratifying and helping thousands and thousands of young people. I do suffer, my adversity is diabetes, but through Road Recovery, I've been able to self-care and manage it.
Amazing. Gene, how about you? Tell us a little bit about your background.
So I come from being a kid obsessed with live music, and that's what gave me peace and solace, and what drove me to want to be a part of this enigma, the energy that comes off a stage. So Jack and I, as he mentioned, through a professor at NYU, both of us weren't really going to school that much, but he knew us both and connected us. Jack was in the management side of it. I was in the tour management. We started working together in 1990. By 1992, my lifestyle, I had just a general fear of life and change. So I found my solution for a long time was drugs and alcohol and the lifestyle of the road, which eventually, thanks to help of people like Jack and other people in my circle, I realized I was in this box of addiction and I was going to die. So I got clean in 1992 and took myself out of the industry and really gave myself over to the medical world to kind of help me figure out how to come up with a new coping skill as opposed to self-destruction. Jack and I then started working together when I came back into the fold when I was 2 years sober, and ended up, Jack was managed a very high-profile artist on Sony, and it was a world tour. And through that, I was very open about my lifestyle, and Jack was very open about what he was going through as far as the diabetic. And that resonated with people in our industry who all started to come forward to talk about their situation, their adversity, from learning disabilities to eating disorders to various mental health issues, addiction and other such, or diabetes in that case, cancer. And what we realized was that there was a voice within our industry that wanted to give back. And given the attraction of young people to the entertainment industry, we thought, could there be possibly a way to bring two unlikely characters together? Both of us, Jack and I, attribute, people in white coats, the medical world, as giving us the solution and the help toward living a healthy life and having a career in the industry. So we thought, how could the entertainment industry and the healthcare world come together through a mentoring program? So basically where the model is, wherever we go, there's healthcare resources and support around us. So we stay in our lane as a mentoring program. We draw from people from our industry who are open about their adversity and the solution they're living, which affords them the career that they have in the entertainment industry, and then the action of the interaction and the action program or action behind our work is through creating live concert events and recording projects by elevating the voice of youth. So the mentoring of showing young people, this is what I've dealt with, and this is what I use as a solution in my life. And the people who helped me with that are people that are professionals in whatever discipline in the industry. And so we're not an arts program. We're really we teach healthy coping skills, communication, and life skills all through the process of collaborating with young people, validating their voice, validating what they want to say in terms of change within themselves, but also change in their community, and using art, whatever that is. Most of the young people, unfortunately, that we deal with, most of them think they have no creativity in them. And we have to remind them that, hey, you're a human being. It's in there. You just got to find it. So through the power of it's a collective where whatever they want to talk about, if it's whatever adversity is going on in their life or transition or frustration or whatever it is, to bring that out, talk about solutions, and then create something that can reach a wider audience. Because we all know art transcends language. And so we give them the opportunity to express themselves, formulate it into something, and then present it on a state-of-the-art stage to their community. So it has a ripple effect. So they're speaking to their peers and their community about what this specific topic is or this area and the solution that they've found in that, and then present it through the power of art, of music, whether it's dance, drama, whatever.
It's amazing. And I think, that's why it's moved me and inspired me so much to help you guys get the word out and amplify what you guys are doing. Because, particularly right now, and I'm a mom of teenage boys, so I know, like the art programs and the art that they're exposed to just isn't what it used to be. And even when I was growing up in the 70s and 80s, it wasn't all that great either, So, but it's like the other day we went to Luna in the city, and all the artists listed there, like I knew them. They were part of my culture. They were part of growing up. My kid couldn't name an artist right now if he tried, other than, a musician. But, from an art perspective, that, and questionable whether or not who he would name would be a musician, whether we would define him as one. But that being said, tell us a little bit. 27 years is a long time. So you have seen, that change. Are there particular, things that have changed, or is it in some ways, teenagers are teenagers and the adversities that they face are similar and the way to access them is similar, or has it changed quite a bit?
It has changed. Technology has obviously come into play, which has created more problems and such for youth, especially isolation. And then you throw COVID, the pandemic into the mix for 3 years, it just adds to it. And then just the way the shift in economics and such is a lot of pressure on young people today in trying to figure out how to make a living, how to survive. So parcel all that together that, it's as far as delivery and such, we've had to adapt because of the means of communication with young people. But still, at the end of the day, it's the number one thing for us is being present. That's it. That's the most powerful thing, is when you show up for a young person, you're consistent and your presence in the moment, not on your phone, you're in the moment listening to them. That transcends. That's the key to the possibility of change, which inevitably would happen, but it takes time. And that's the other thing. We've created such instantaneous everything, and change in the human condition doesn't happen that way. A pill doesn't work. It only works to a certain point. It's really about building relationships, and relationships take time and trust. And we've dealt with every conceivable possible situation of what young people are dealing with. And that's just, the human connection is everything.
So Jack, tell us a little bit about, kind of specific outcomes or specific stories that you've seen over the years that, have given us that, have given you that measure of success.
Yeah, some major changes for road recovery, especially since our nonprofit was awarded 2 federal grants from the U.S. Department of Justice, Office of OJJDP, Office of Juvenile Delinquency, is that part of getting the funding for our youth programs was also getting access to the National Mentoring Resource Center. They provide program evaluators. So we had a program evaluator who has been helping us for almost 4 years from Mentor in Virginia and the NYU School of Nursing, Myers School of Nursing, a research scientist, Dr. Lloyd Goldsamt. And they have come together to advise us very closely on measuring outcomes because we want to know how successful are we? Is our program model working or not, right? And what changes we may have to make in the programming. And they help to develop surveys, pre and post surveys, over 24 questions for young people to sample and respond to us. And through that, we're able to determine and measure outcomes. The specific outcomes that we've been measuring are self-esteem, self-sense, sense of team and belonging, social competence, attitudes about substance abuse, and coping skills, which is central to what we're doing right now. And through these pre and post surveys that the kids take, we're able to measure, where they're starting and if they're improving or not. Now, it's really hard to get these kids to do paper survey questionnaires. So what we've developed is this Tracks program app. It's very innovative. It took us 6 months to put it together with an app company called Team Recovery Technologies. And all the kids have an app either downloaded on their phone or gain assistance from their mentor staff member. And that's how they're able to come in. When we first come in, we check their mood. They can do a happy face. They can do a sad face. That alert would go out to Gene and others, and then at the very beginning of the program, we would see where they're at, their headspace is at. And then after the workshop, they spend an hour or two with us. They do a check-in after, and we can measure if the mood has changed in any way. And then for more longitude stats, we have the pre-survey, as I said, 24 questions or more, and then the post-survey. And that's really where we develop scale scores so we could determine whether they're going up or down. I'm happy to say that most of the measuring outcomes have gone 5%, increased 5% or more. So that's a big indicator for us that Tracks programs, that's the name of our after school programs, are working. But there's always work to do to improve that.
Yeah, that's great. And that's great that, having that kind of system of measuring outcomes and the success in there is great, and to sort of have that consistent feedback. I'm sure, to some extent, just getting the kids engaged must be so rewarding, and that's the impact you're looking for and keeping them engaged, because that's what's hard. I think besides the fact that it's just hard to get access to mental health in general in this country, particularly for teens, but getting them engaged.
You're listening to Digital Health Talks. When we return, we'll continue our discussion on how technology is revolutionizing healthcare delivery. Stay with us to hear more insights on creating sustainable, patient-centered digital health solutions.
Tell me a little bit about where you've seen, has that changed over the years in terms of access and what the sort of barriers that teens face in getting that access to traditional mental health services, and tell us a little bit about how Road Recovery kind of helps with that.
Yeah. So with the healthcare system, which I don't think any of us can explain, and the resources, so more and more out of the box means of reaching young people and such. So as a mentoring program, I think our success has been because we partner with Road Recovery. Never travels without some type of partnership with healthcare folks. So how do we do that? We stay in our lane. So our program is inserted into institutions, whether it's inpatient or outpatient, or we're a lot. In the case of these grants, we're in New York State youth recovery centers. These are or clubhouses, as they're called. So they provide everything from after-school programs to food to clothing to recreation and such. And our model is inserted in that, and then embedded in that location are licensed social workers. And because it's in the community, so if we have a youth that hasn't eaten, we have access to. So we're never on an island with the young people. So in this, it's sort of a way that you're managing, you're dealing with these on a per situation basis, where in some cases where at some point along the line a youth needs to find inpatient. Well, we have an army around them, and those, because they're tapped into us, which means they're tapped into those resources to find those medical resources or the treatment that the youth will need, or like I said, basic stuff like clothing or whatever. So it really becomes a one-stop shop for us, and I think a lot of it for us is the attraction. So what we're able to do is we have credible messengers. So these are people that have life experiences, and they're not the authority, and we're not there to point a finger at them or anything, but we're actually opening up about our own adversity. So all of a sudden it creates an intimate situation by, kids will respond to, if you're vulnerable, and being willing to be vulnerable in a safe environment will cause them to open up. So, and because we're not the police, teachers, or medical professionals, a lot of times by us opening up about what we've dealt with, they will then start to open up. And a lot of times they'll reveal stuff that they haven't revealed to their parents or to anyone in their circle. But what's most important is we're shedding a different light on those folks. So by me talking about recovery and the resources that I use, whether it's the clinical help and therapeutic or whatever, or Jack's talking about medical, as an endocrinologist involved in him, that just all of a sudden it shifts the whole view of perception of what these people are, that they're not a threat, they're actually an asset, and to lean into them. So it's lead by example in all of this.
Yeah.
And that has created access to interesting resources for them.
Yeah. I mean, what I'm hearing a lot is, it's about meeting them where they are and really engaging with them. And I think we're seeing that around, a lot of the discussion of the digital and virtual mental health tools, is that they are working, and they are, sort of engaging teens and kids in a way that they, haven't been able to, that a traditional therapy and traditional mental health services haven't been able to do. I think you guys were way ahead of the curve and got to that, super, a long time ago. And I know, as you mentioned, the healthcare system and the current political climate, there's a lot going on that is impacting funding. So tell me a little bit about how these recent funding cuts are affecting the services and what some of the creative solutions you guys are working on, but how our audience can really help.
Sure. Our primary source of funding had been through DOJ, as I said, these two massive grants that allowed us to forge these partnerships from Buffalo to the Hamptons and cover all the youth clubhouses that Gene cited for after-school programming services. There was one point we were up to servicing 12 youth clubhouses and their affiliates each cycle. So that's like Monday through Saturday programming. Now, unfortunately, with federal cuts and given the atmosphere, what's going on, we're down to one single federal grant, and it's providing maybe 2 or 3 or 4 after-school programs. So on a programmatic level, we've come, unfortunately, way down, right? But I will get to what we're doing. Right. But when it comes down, we have all these experienced creative staff mentors, the credible messengers that Gene was talking about. And some are sitting on the sidelines waiting for the next call of when they can get back in. We pay all our mentors, all our staff members. And with the funding cuts, we can't pay them. We can't get them going. Right. So that's a major negative hit on us. However, once we learned that on March 29th that our federal funding had been cut, literally I couldn't draw from U.S. Treasury on that day, we went into an emergency meeting with our board and we came up with an action plan, right? And the action plan since then had been to pursue a number of private funders, non-federal funded authorities. So that would be foundations. Obviously, we do a number of fundraising, especially getting a lot of individual and corporate donations through our website, www.roadrecovery.org. And we have a tremendous amount of our income goes to direct programming. So it was 83.3% in last year. So that's how much we dedicated. We're still in the action plan and pivoting away from the federal funding. We have it maybe for another year, but you never know. We can wake up, another executive order or another legal decision has been made, and all that funding goes out the window. So 27 years, we've learned to adapt to what's happening under all situations. But this, I'd say, Gene, is probably one of the most dire that we've had, especially given the tremendous success that we've had. And DOJ has told us, you're one of the leading cohorts in servicing young people with their adversities and addiction and opioid-affected youth.
Anything else in terms of, kind of beyond those financial contributions that you've seen work that you would suggest to those specific companies, or, whether it's the health IT, digital health side, or community-based organizations that you wanted to share?
I think that there's great power in this, and the ability of what technology has allowed young people to do. From even on a creative level, like you mentioned earlier, an artist, are they an artist or are they not? I mean, the technology is so strong that it's been scientifically proven I have no musical talent. I was a nuts and bolts guy, and I've had more drumsticks taken out of my hand because, Gene, you have no rhythmic talent and ability. So I think that leaning heavily into it, the upside is because it's what we're finding is you can effectively reach a young person at any point, any time. But the downside is also how to engage with them and not to further drive home this isolation and the downside of what this technology is. So thanks to our research folks and us just very organically launching this app, we've started to learn other things and facets and on greater levels of care and support for our young people. And one of the things that we've learned is, so we, at the beginning and the end of each session, that we're actually physically with them, and we have a hybrid. There's also a virtual that connects too. It's all happening simultaneously. But they're filling out, as Jack said, a little survey. How are you feeling coming into the program? And then how are you feeling when you leave? What's interesting is we have some young people, and just happened this past weekend, where they reported coming in, they weren't doing well, okay? And they talked about it. But when they left, they didn't say anything. But they went to the app and they said when they left, they felt lousy. Well, we get an alert, immediate alert. So we're able to take action. How do we take action? We call the licensed healthcare providers at that facility and say, hey, we just got an alert that so-and-so came in on the app and said they weren't doing good and they went out not doing good. Could you please look at that? So that's a whole nother reality, because in some cases, this person didn't want to say it to anyone, but they felt comfortable to tell it to the app, the technology. So we've now figured out, like, wow, we've created another layer of support and a means of giving them a safe space to express where they're at.
Yeah, which I think, and I've did a little bit of looking at, YouTube has a program going now with the American Psychology Association around, sort of the positive uses. How do we turn, what we know is a dangerous, element of social media and technology, and I think, the point of Anxious Generation is that we've bottled our kids up so much that we've protected them, and, so much in the real life, but we've allowed them so much access to the internet and to what's available to them on social. On the other side of things, the ability to make what is available to them positive, and that's where, it's not the technology, it's what's out there that is dangerous. Right. And so we wouldn't want to, not let our kids go to the museum or go to a concert if that's where they wanted to go in real life. So how do we make that environment that they're going to online a more protected, a more positive one? And what you guys are doing does that so well. And I want to see it both succeed and grow, and it just has so much potential of bringing all this together. So, we have a minute left, and we always do like to focus on kind of what's good and what's good in healthcare right now. Whereas, when you look around at what's happening within road recovery and the teenagers that you guys help, tell us what's good. What's good that you're seeing?
We're seeing them. The best is they're showing up, and they continue to show up. And in some of the cases where there's been some some pushback and such on these kids, and because they're being attacked because of whatever gender or whatever, they're showing up because they're finding support. And I think that tells the tale right there. Where it's not about the talk; it's about the action behind it. And the more we learn of how to best serve our youth, the better we get, and the better the outcome is, which is helping serve our greatest asset, which is our youth.
Yeah, these youth are showing up every week to their Tracks program. Of course, Road Recovery is showing up on a consistent basis for them, and they have a voice that they can share. We are featuring them on social media if they want to be featured, their music, their artwork. Then after a 3-month cycle, they can get on the big stage with professional sound and lighting that we set up, and the show is filmed, and they can share it with their community, their parents, their best friends, and in some cases, they're doing recording projects. The latest recording project is with not only our mentors, but Daryl McDaniels from Run DMC, our board member who recorded with the kids. And the new song is called I Am Love. It's available on Spotify and Apple Music. So they have something they have for the rest of their life that they can always look towards during their road recovery time. So yeah, it's these positive, tangible outcomes that are really making a difference in their life.
It is. Well, and that's it. I think, one of the great things in healthcare is you guys. So, and the group that you have assembled together to do this, the board and the folks on the technology side, as well as the work that you guys are doing, is amazing. So thanks for being with us. I want to call to our audience to please go visit roadrecovery.org, check out what they're doing. If you're so inclined, do donate, get involved, reach out if you've got ideas for partnerships, for support, additional funding avenues. There are private groups that would fund this. So if our listeners are there and know of things, let us know so that we can help support what Gene and Jack are doing, and the whole team at Road Recovery that is just so impressive. So thank you both. It was a pleasure.
Thank you, Megan.
Always.
Thank you, Megan.
And thank you to our listeners. Don't forget to subscribe to Digital Health Talks wherever you get your podcasts. And this is Megan Antonelli signing off.
Thank you for joining us on Digital Health Talks with hosts Megan Antonelli, Janae Sharp, and Shahid Shah. For more insights on healthcare innovation and a deeper dive into today's discussion, visit healthimpactlive.com. Join us next week as we continue exploring the technologies and strategies transforming healthcare.